It's always a question that people ask, and always surprised when we tell them, it's a 15-year journey to get to subspecialty like this. When you look at undergraduates, medical school, and then a 5-year residency, and then 2-year fellowship. So there's a little bit of time. Certainly when you're a medical student, there's so much pressure in picking that career path. And a lot of us always think, I hope I picked the right specialty. And you do that a lot in your first year of training. I thought I wanted to be a pediatrician, and I remember realizing that I loved, taking care of children and looking after families, but it's actually the other side of it, like bringing them to the world, that I was more interested in. And so in first year, I'll never forget being able to do the first cesarean section, and I got out and it was like such a big high, and I remember thinking, okay, I'm in the right place. I know it's a 5-year of residency. It's a pretty busy residency. We do a lot of night shifts. Obstetrics is notorious for being being up all night. I remember just thinking, I'm at home, this is where I belong, and just love the adrenaline of delivering a baby and taking care of this really kind of important part of people's lives when they're coming in having a baby. It's a privilege to be there, and I get to be part of it. So that was one of the moments I remember thinking, this is going to be great, and certainly remember that although I was tired at the end of the night, it was really exciting to go home knowing that I was able to help those families. Lots of different cases. The first intrauterine transfusion I was involved in as a fellow. This is something what we do. We provide blood transfusion to a baby before they're born because they're found to be anemic, and it's a really life-saving procedure. So doing that as a fellow was spectacular to see. I enjoyed those challenges. I enjoyed just as much as the happy, fun, easier deliveries, being part of the harder journeys, and there was even more reward for me, really. It was great to see the family leaving happy with a child in their hands, especially families that never thought that would be a possibility for them. And so I think back to many cases that really cemented that love for the specialty.